Welcome to Thrive with Pride from AgeOptions, an online space for LGBT older adults and those who care for them. This is a recording of a live event held on Zoom, which included a lively Q&A that was not recorded. This month, we welcomed Elizabeth Durkin, Manager of Healthcare Education and Counseling here at AgeOptions, and Georgia Gertis, Advisory Training Specialist at AgeOptions. Elizabeth and Georgia both work within Avisery, which provides tools and support to professionals serving older adults and people with disabilities, enabling them to access healthcare coverage. With Medicare's open enrollment period coming up, starting on October 15th of every year, we wanted to offer you some solid, unbiased information on your healthcare choices. Please see the video description below for a PDF of the slides presented in this recording, including several helpful resources to help you make Medicare work. After you watch, please fill out a very short survey to help us improve our online programming. It is anonymous and will take you less than 5 minutes. The link to the survey is also in the video description below.
Thanks, Kate, for that introduction. And as you can see by the presence of people from the advisory team who are here today, we're just really excited to be able to do this presentation for the Thrive with Pride Cafe. Advisory primarily educates professionals who work with older adults and people with disabilities, and we don't do as many consumer presentations. So we're excited to have this opportunity today. These are the topics that we're going to be covering today, and it is a lot, and so we'll be taking a break midway through to see if we have any questions that people have had on the first half. But we'll start with just talking about what is Medicare. So Medicare is a federal health insurance program for people who are either 65 years of age or older, or people who have disabilities. And it's administered by two different federal agencies. So the Social Security Administration determines who is eligible for Medicare and handles the business of enrolling people in Medicare. And then the Centers for Medicare and Medicaid Services, which is also known as CMS, runs the Medicare program kind of on a daily basis. And to be eligible for Medicare, you need to be 65 years of age or older, or if you're under 65, you can qualify if you meet these certain criteria. So if you have been receiving disability benefits for at least 24 months, and those can either be disability through the Social Security Disability Insurance or through the Railroad Retirement Board, but once you have had 24 months of receiving disability benefits on that 25th month, you can qualify for Medicare if you're under 65. Also, if you are under 65 and you have end-stage renal disease, or if you have ALS, which is also known as Lou Gehrig's disease. So even though we tend to think of Medicare as being a program for older adults, younger people can be on Medicare if they have these certain conditions. There are also some citizenship requirements for being on Medicare. And if you are curious as to how people become enrolled in Medicare, there's two different ways. Some people who are eligible for Medicare will be automatically enrolled by the Social Security Administration. And the way that this works is that if you are already receiving Social Security benefits, if you're getting a check from Social Security, and then you become eligible, so you turn 65 or you reach that 25th month of collecting disability benefits, the Social Security Administration will automatically enroll you in Medicare. And about 3 months before the date that your coverage will begin, you will receive in the mail a welcome to Medicare packet that has a lot of information in it. Now, someone who is automatically enrolled in Medicare can actually request to postpone their enrollment, but that is something that should be done carefully because there can be penalties that happen if you don't enroll at that time. So we'll talk a little bit about how to avoid penalties and why they might have them in just another couple slides. So because some people are automatically enrolled, we then have the category of people who aren't automatically enrolled and who need to apply. And part of the reason that this has happened is that it used to be, when the laws were originally passed, that people became eligible for Social Security benefits and became eligible for Medicare at the same time when you turn 65. However, the law has changed in recent years, and so now there are some people who are not eligible to get full Social Security benefits until they're either 66 or 67, depending on the year they were born. And so if you turn 65, or if you hit your 25th month and you are not receiving Social Security benefits at that time, you will have to apply for Medicare. And other people who would need to apply would be people who earlier, when they got their Welcome to Medicare packet, declined enrollment. So those are the two categories of people who do need to apply. And as we mentioned before, that application happens through the Social Security Administration, not through CMS. So Social Security Administration is who you need to go to if you fit in these categories, and you will need to apply for Medicare. When can you first enroll in Medicare? So this picture of a calendar is designed to help you understand a key term that has to do with Medicare enrollment, and that is called the initial enrollment period. When you are initially eligible for Medicare, the period of time that you have to enroll is 7 months long. It's 3 months before your birthday, the month of your 65th birthday, and 3 months after your birthday. And if it's that you are qualifying for Medicare because of a disability, instead of the birthday month, it's that 25th month of having received disability benefits. If you enroll in Medicare at any point during the 3 months prior, then your coverage will begin that birthday month. And if you wait until later, into the last 3 months, there's different ways that it works about when your coverage actually starts. So the best thing to do is to enroll in one of those 3 months prior to your qualifying month, your birthday or your 25th month of disability. But if you do enroll at any point during this 7-month period, you will not face any penalties, any late penalties. This is the time period that is on time to enroll in Medicare. There are other times that you can also enroll if you miss that initial enrollment period. So for people who didn't enroll during that 7-month time period, every year there is an opportunity for people to enroll in Medicare, people who are eligible. It's called the General Enrollment Period, and it lasts from January through March of every year. So if you missed your mailings, if you didn't understand and didn't enroll during your initial period, you have this opportunity every year. Right now, the way it works, however, is if you apply between January and March, you will not receive coverage until July 1st. So there'll be several months in that year when you don't have coverage. The good news is that as of a year from now, not 2022, but 2023, there is actually a law passed recently, and it's going to change that. So as in the following year, it will be easier and you'll be able to get coverage the month after you apply. But for this coming year, 2022, you'll still have to wait until July 1st to get your Medicare coverage if you apply during the January to March general enrollment period. But as I said, when you enroll during this time, you will face penalties for not having enrolled during your initial enrollment period. And it is those penalties will kind of get larger and larger the longer and longer you wait. Medicare really wants you to enroll when you are initially eligible. And so they incentivize that by giving you penalties if you delay. And they can add up if you're not careful about it. However, there are some people who really have a good reason during their initial enrollment period not to sign up for Medicare. So there's a lot of different kinds of circumstances in which that might be true. One of the more common ones is that oftentimes nowadays people are still working when they turn 65 and they have health insurance through their employer, or they may have a spouse who's working and they get health insurance through them. And so when people have kind of a legitimate reason for not enrolling in Medicare, they can be offered what are called special enrollment periods, where they're able to enroll even without a penalty. I know this is a lot of information to keep track of. It's really just the main takeaway I want you to have is to understand that it really makes the most sense, if you can, to enroll in Medicare during that initial time that you become eligible. If you choose not to enroll, you want to be very careful to make sure that you would qualify for a special enrollment period later so that you don't face a penalty. But even if you don't, you will always have this general enrollment period every year in which you can apply, but you may have to pay extra because of waiting. Once you do enroll in Medicare, there are two different ways that you can receive your Medicare benefits. The first one is called Original Medicare, and it's original because it's how the law was written originally in the 1960s when Medicare was passed. Original Medicare, you have a lot of different parts. You've probably heard people use this kind of language. They talk about Part A, Part B, Part D. These are ways that you can get your hospital insurance, your medical services, and we'll go into detail about all these different parts in just a few minutes. The other way, if you want to use an alternative way of getting your Medicare benefits, is through what's called a Medicare Advantage plan. Medicare Advantage plans combine parts A and B into one plan, and then they also often will also include Part D, which is prescription drug coverage. So we just want you to have this general picture that there's two different ways you can do it, and we'll talk about each of these in the following slides. So with Original Medicare, as I said, it has Part A, which is hospital insurance. That's for when you go into the hospital. And Part B is your medical insurance, which is doctor's visits and other kinds of things that we'll talk about. So it's important to know you can have both Part A and Part B, or you can have only one or only the other. But you can see from the picture that if you were to have only one, then you will have some gaps in the kind of healthcare coverage that you have. In terms of Part A, we'll talk a little bit about what it covers and how much it costs. But it's important to know that most people can actually qualify for premium-free Part A. If you have been a person who has paid Social Security taxes for what is basically the equivalent of 10 years of working, if you've paid those Social Security taxes, you will get Part A Medicare coverage for free. If you have been married to somebody who qualifies, or if you were previously married to somebody who qualifies and you were married to that person for at least 10 years, you can also get premium-free Part A, even if you were not yourself able to work for that whole 10-year period. And then finally, people who are eligible for Medicare, but they don't have that qualified work history, they still can get Part A, but they just will have to pay for it. They'll pay a premium directly to Medicare. But a large majority of people will actually get Part A for free, which is good news. What does Part A cover? So we talk about it as being hospital insurance, but it actually covers a number of different kinds of services, both in and out of the hospital. So obviously your inpatient hospital stays would be covered under Part A. You also can have Part A cover time that you might spend in a skilled nursing facility, which is a place you may need to go after being discharged from the hospital because you're not yet well enough to go home. And skilled nursing facilities provide a little bit more medical care, and maybe some therapies are available at a skilled nursing facility, but it's where you can go when you don't need to be in the hospital anymore, but you're not quite ready to go home. Home health care is also a kind of service, a skilled nursing service that is provided to you in your own house. And again, it's designed to be a little bit more than, or a little bit less than what you get in a hospital, but a way to be able to discharge you from the hospital earlier. So Part A also covers that. And then Part A also finally covers hospice programs, which are for people who are terminally ill. So it's important to know, though, the one thing about Part A is that although it does cover your time in the hospital, it doesn't cover the physician's services that you received when you were in the hospital. So if you are the nursing care you get in the hospital, the tests that might be run, the lab work that might be done, the actual staying the night in the hospital, that will all be covered by Part A. But if you see a physician while you're in the hospital, that gets billed separately. That gets billed under Part B, which we'll talk about in just a few minutes. Part A is structured a little bit differently than what most of us are used to with an insurance plan. So we normally are used to where you have an insurance plan where you have an annual deductible. And every year, once you pay that deductible out of your own pocket, then your health insurance coverage starts to kick in. We have that with car insurance. We have that with a lot of different kinds of insurances. There's that deductible that you have to pay first. With Part A, they have something called a benefit period, and the deductible is applied to the benefit period and not necessarily on an annual basis. I'll explain a little bit more about what that means. So the benefit period starts the day that somebody is admitted as an inpatient to a hospital. So the very first day your benefit period starts. But the benefit period doesn't end when you leave the hospital. It ends when you have been out of the hospital and you have been home or in another kind of community setting for 60 days in a row without ever needing to go back to a hospital or to go into an inpatient skilled nursing facility or other kind of inpatient setting. So once you've been home or sort of out of inpatient care for 60 days in a row, that's when your benefit period ends under Part A. What this means is that you are charged a deductible for each benefit period, and you can have multiple benefit periods in the year because they accrue every time you go back into the hospital after your last benefit period was over. So to kind of tell you how that works is the benefit period deductible is set every year. This year for 2021, it's $1,484, but it can change from year to year. So it's important to understand that it could go up, it could go down, but most likely it will go up in 2022. If you go into the hospital at any point in the year, and like say you had a gallbladder surgery, it was kind of simple, they had the surgery, you left the hospital, you went home, and you never went back anywhere. So that is your benefit period would then end. However, if you then a few months later, say you had a stroke and you had to go back into the hospital, it's the beginning of a new benefit period and you would have to pay that deductible again. And so that is how the Part A costs can add up for people if they have, say, multiple health conditions that cause them to have to go into the hospital more than once in a year. Other kinds of costs that happen related to Part A, so you have that deductible, as I explained, it gets charged the very first day that you enter the hospital. It's $1,484 in 2021. And without reading all of these in detail, you can see that then depending on how many additional days in the hospital, there are different charges that are associated with hospital care. Also, Part A costs are related to those other kinds of services that Part A covered. So skilled nursing facilities, home health care, hospice care, all of those have different costs associated with them that I I'm not going to take up your time right now explaining, but just so that you're aware that the different kinds of services will have different costs. It's important to try and know what they are before you will need to be using a service, and that all of the information will be available on Medicare's website, and we'll be providing for you a document that has links to resources that will help you research this and understand the costs that you're facing under Part A. So this is where I'm going to take the quick pause, because I know that we have been, that I've been talking about a lot of stuff and that it's complicated. So I wanted to see if anyone has any questions right now, if you have either put them in the chat before or you'd like to add them into the chat now. And I'll turn it over to Georgia to see if she has any questions that have been entered in the chat that she wants to address.
We only had one question regarding why someone would want to decline enrolling in Medicare when they become eligible, either due to age at 65 or because of a disability. And it could be a variety of reasons. It could be an error because they didn't know they had to contact Social Security to enroll. It could be because they had other health insurance through their job, through their employer that was the primary payer. Or it could be because they choose not to enroll due to premium costs and they don't want to pay the premium. So there's a variety of reasons why someone may delay enrolling in Medicare. The rule of thumb to remember, though, is like any type of insurance, you don't need it until you actually need it and get sick. And if that does happen and you decide to delay enrolling in Medicare and something happens, knock on wood, you may not be able to have your Medicare in place to help pay for your emergency care. Just like car insurance, homeowners insurance, you want it there in case something happens. So as Elizabeth said, the rule of thumb is to enroll when you're first eligible. We have another question that says, I don't pay for Medicare, but some of my friends do. Why is that? Now, there are programs that can assist individuals pay for their Medicare premiums, which I think Elizabeth's going to talk about in the second half. But for individuals with limited incomes and or assets, there may be benefit assistance programs that help pay for some of those Medicare Part B premiums or those Medicare copays. For individuals who may be slightly over those income and or asset limits, unfortunately, then those folks would not qualify for those assistance programs to help pay the premiums and copays. Any other questions? Nope.
Okay. All right, then I'll keep going and try and get through this quickly. I know people, it's a topic people do like to talk about, but it's also important to, make sure everyone understands as much as they can about this program, because it's pretty complex and it's easy to make mistakes that could end up costing money. So we just want to try and make sure everyone knows as much as they possibly can before making any decisions. So now I'm going to move on to talk about Part B, which is medical insurance. So Part B covers all the kinds of services that are showing up here on your screen. It's mainly doctor services. And as I said before, that's inpatient. Doctor services are not covered under Part A, they're covered under Part B. Also, hospital services that are done on an outpatient basis. So that's like maybe you go in for a colonoscopy or a mammogram or some other kind of test that's done in the hospital, but you're not actually admitted. Those are outpatient hospital services that are covered under Part B. Also, lab services, diagnostic tests, ambulance is covered under Part B. Some durable medical equipment. And these are the kinds of things that if you have Part B, it will cover. But Part B has costs. Unlike Part A, there's no premium-free Part B. So when you enroll in Part B, as Georgia was saying, it does have a premium cost to it. And that is something that people sometimes are thinking twice about. In 2021, the standard premium is $148.50 a month. Again, that could also change in 2022. And certain people who are kind of at the higher end of the income scale, they may end up paying more money than that, but most people will pay the standard premium of $148.50. The Part B deductible does work more like a normal deductible that you'd expect. It's assessed annually. And so once a person has paid that $203 out of their own pocket, then Medicare will start to cover all of those Part B services. Usually the way it works is that Medicare will cover 80% of the amount for those medical services, and the beneficiary will pay 20%. There is Medicare approves the amount that your provider can charge. So a provider can't just say, I'm going to charge you $1,000 for an office visit. So it's also important to make sure when you're using Medicare that your doctors are participating in the Medicare program and that they'll, kind of cooperate with the rules that Medicare has around charging for things. There are a few kinds of services where it doesn't work on that 80%, 20% way of paying, but those services that will have a fixed amount that Medicare will pay towards that service. So a visit to an ER, certain kinds of surgical services, Medicare will pay only a fixed amount. So that's Parts A and B, original Medicare, as was put together, again, as I said, when the law was passed in the 1960s. Medicare doesn't cover everything though, right? Many things actually you would think would be covered are not. So most dental care is not covered by Medicare. Most vision care, hearing aids, all of those are not covered by Medicare. And so if you only have Medicare Parts A and B, you would not be able to get any coverage for those services. Things like cosmetic surgery isn't covered. Also, a lot of people don't know that if you get sick and need healthcare outside of the US, that under most circumstances, with just a few exceptions, Medicare will not cover healthcare outside the US. And so for people who receive Medicare and who are going on a trip abroad, they need to investigate like getting alternative policies that will cover their travel. And alternative medicines like massage or acupuncture, sometimes with some limited exceptions, alternative medicines aren't covered by Medicare. Nor is non-emergency transportation. So like if you need a van to get you to a doctor's appointment, if it's not emergency, that won't be covered by Medicare. And finally, another really big thing that original Medicare does not cover, that many people are under the impression that it does cover, is what we call custodial care or personal care. This is when you need help with bathing or dressing or eating, often the kinds of services that are provided in a nursing home, but even if they're provided for you in your own home, they would not be covered by Medicare. Also, housekeeping services for like cleaning your house or making meals for you. The bullets here show that there are some exceptions, and Medicare does in some circumstances pay for this type of care, but those exceptions are limited. And then certainly somebody who is in a nursing home for long-term care, meaning they are staying in the nursing home and that's where they're living on a long-term basis, getting primarily custodial care when they're in that kind of a setting. Medicare will not cover that. So for people who have meet certain income guidelines, Medicaid, the Medicaid program, will help pay for nursing home care. But otherwise, people may end up having to pay for nursing home care out of pocket. So it is not covered by Medicare. All right, we've talked about Part A and B. We're going to skip Part C for the moment and talk about Part D, because this is another thing, a kind of coverage that people commonly have. Part D is prescription drug coverage. It was added as a benefit to Medicare in the 1980s, so it was not part of original Medicare. And Medicare Part D are prescription drug plans. They're offered by private companies that contract with Medicare. So the federal government isn't directly providing coverage for these. It is done through private insurance companies. You can get Part D coverage either by getting something that is called a standalone prescription drug plan that you would get. So for example, if you had A or B coverage, you might get then a separate plan that would give you your Part D coverage. But a second way that you can get your Part D coverage is working through a Medicare Advantage plan. As I said a few slides back, Medicare Advantage plans sometimes include drug coverage in them. And I will give you some additional details about Medicare Advantage in just a second. But for all these prescription drug plans, the company will have something that's called a formulary, which is a list of prescription drugs that the plan covers. And they vary from company to company. So if you get your Part D plan through one company, they may cover different drugs than another company, which means maybe your drug coverage is different from your neighbors or from your sisters. The costs that are associated with Part D plans will vary a lot depending on the company that you buy them from. So they charge different premiums every month. They charge different deductibles, although there's a limit to how much of a deductible they can charge. The highest amount for this year is $445. Another thing that impacts your Part D costs is something called drug tiers. So I just mentioned that every company has a formulary, a list of drugs that they'll cover. They may split that list up into different categories or tiers of drugs, depending on how expensive the drug is. So low-cost drugs, you might be in the lowest tier and you would have a $5 copay for a drug that is inexpensive. As you get to higher and higher tiers of drugs, you may have to pay a much larger copay for that. And so that can drive your Part D costs up. There's also an aspect to Part D plans where over the course of the year, there are different phases to Part D coverage. And depending on the phase that you are in that year, that can also impact your costs. Again, that's a pretty complicated topic to go into the phases of coverage. And I don't have time for that today, but it is just something to be aware of, that your costs may change. And again, you can research using the resources that we've given you to understand how those phases work. Part D, to enroll in a Part D plan, you have to have Part A or Part B in order to get a Part D plan. And I'm going to skip through this slide. You'll have it as a resource, but I'm only just going to point out that there is an initial enrollment period that is just like your original Medicare enrollment period, and that is the best time to enroll in Part D without getting any penalties. And then, as Kate pointed out, there is an what's called the annual open enrollment period. It's starting in a couple weeks. And this time is a time every year where people can choose to join a Part D plan or switch or drop their Part D plan coverage. So that is happening momentarily. As I said, there's a late enrollment penalties for Part D if you don't apply when you're supposed to. And it's important to just understand that, again, timely enrollment is helpful, because if you don't enroll on time, you can have this penalty and you'll pay it all the time that you have Part D coverage. Every month you'll be paying a penalty based on how long you delayed enrolling. Now, as we've Georgia talked about just a little bit, but also, as you've seen from everything I've said so far, Medicare is great to have Medicare coverage versus not having any coverage at all. But I went through a lot of the different costs that can happen with Medicare plans, and it can be overwhelming. Like, how could I afford this? I have a limited income, perhaps. And so there are ways that can help paying for Medicare. You can be just familiar a little bit with these names, and then learn more about them when you have more time. There are plans that are called Medicare supplement plans. They're also known as Medigap plans, and they work if you have Part A and B to help you pay for those costs that I listed that were associated with Part A and B. The Medigap plans are sold by private companies to help supplement your Medicare A and B. There are also Medicare Advantage plans. I talked about them a little bit. And if you were wondering why I skipped Part C, this is Part C, Medicare Advantage. Medicare Advantage plans, again, were not part of original Medicare. They were introduced later. And they're run also by private companies. You need to have Part A and B to get a Medicare Advantage plan, and they cover everything that regular Medicare covers. But as I've said, they may also include Part D coverage. So that's a way you can get all these things into one plan, your A, your B, and your D coverage. And Medicare Advantage plans also often offer benefits that aren't offered through standard Medicare. So people are interested in Medicare Advantage plans often for these extra benefits that they provide. But one of the ways that Medicare Advantage plans help control the costs that they have is they require people to go see providers who are in a network. And if you go to someone outside the network, the Medicare Advantage plan won't cover the cost. And so that's something to be careful of when you're thinking about a Medicare Advantage plan. And finally, as Georgia mentioned, there's something called Medicare savings programs that help people who are low income to help cover the costs of Medicare. All right, that was so much. I really appreciate that you sat through all that, because I know it's a lot and I know it's overwhelming. We really just wanted people to be familiar with some of these basic terms, to understand that there are costs available to Medicare, or costs associated with Medicare, that enrolling early is something you should really try and do if you can, and just are going to provide these additional links and resources for you to learn more. I want to draw your attention to one program that we provided the link for. It's called the Senior Health Insurance Program, or SHIP. SHIP offers unbiased counseling for free to older adults who want to ask questions about their health insurance coverage. And so that's something we just want you to be aware of is available to you to help you navigate through all this complexity.
Thanks again to Elizabeth and Georgia for an enlightening presentation. Don't forget to see the video description below for a copy of their slides, which include many helpful resources that can aid in sorting through all your coverage options. If you are a resident of Illinois, contact the Senior Health Insurance Program at 800-252-8966 or by email at aging.ship@illinois.gov to receive free and unbiased advice on your Medicare and insurance options. We will list the web address to find out more about the SHIP program in the video description as well. Please join us for our next monthly event on October 26, 2021, when we will be celebrating LGBT History Month with a presentation from Professor John D'Amelio from the Gerber Hart Library and Archives. Dr. D'Amelio will be presenting on Chicago's storied LGBT past and sharing some treasures from the archives. Login information is at our website and below in the video description. Thanks for watching, and please don't forget to fill out the quick survey below.